On this episode of Putting Possibility into Practice, we're talking Intergy for orthopedic practices. I'll talk to the CEO of Mercer Bucks Orthopedics about how the practice has used Greenway Intergy to fuel its success and its continued growth and enhance patient care every day. Plus, we'll talk about expansion of Mercer Bucks and their newest addition to their practice locations and how you can take a look inside it with their virtual tour, plus advice for other orthopedic practices who are considering Greenway's Intergy solution. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health. And if you are new to our podcast, thank you for giving us a listen. And if you are a returning listener, welcome to another episode of Putting Possibility into Practice. My guest today is the CEO of Mercer Bucks Orthopedics, Tony Mulchaney. The practice provides orthopedics, physical therapy, and occupational services. We'll be discussing how orthopedic practices can utilize the features and functions of Greenway's Intergy platform. But before we get into that, well, I welcome Tony to the podcast. And Tony, why don't you tell our listeners a little bit more about Mercer Bucks Orthopedics?
Sure, Joe. Thank you very much for the opportunity to reacquaint and with your listeners about the opportunities that Greenway offers and a little background about us for those listeners that retuning in. We're located up in Pennsylvania, New Jersey. We have 6 different office locations that range from Trenton, New Jersey, which is located the state capital of New Jersey. We cross the river over into Pennsylvania, where we have 2 different locations. And then we have 4 other locations in New Jersey, from Princeton, Lawrenceville, down to Marlton, New Jersey. So we cover a large area of the Mercer County, Bucks County region of Mercer County, New Jersey, and Bucks County area of Pennsylvania.
And I had, how many patients do you, on average, usually see annually?
Joe, we see approximately 100,000 patients a year that go through our facility at the different locations. We have approximately 40, including our physical therapist providers, 40 different medical providers that range from our physicians to our PAs to our therapists. We also have some durable medical equipment or DME specialists that do a lot of bracing for patients. So we offer a variety of different services that are both in our office and at our brand new state-of-the-art ambulatory surgery center located in Lawrenceville, New Jersey.
And that will bring me to my next question, as I saw it on your guys' website. So talk a little bit about the new state-of-the-art ambulatory surgery center that you guys opened in October of 2018.
Sure, Joe. We opened up a 15,000 square foot state-of-the-art ambulatory surgery center October 1st of 2018. The center offers 2 operating rooms, 1 procedure room, 2 endoscopy rooms, a state-of-the-art facility for pre-operative and post-operative patient care. We have 2 private rooms that we maintained as we opened a new center. We've also expanded one of the first facilities doing outpatient joint replacements. We started that approximately 2 years ago and certainly outgrew our facility. We've now successfully completed approximately 200 joint replacements that have been done on an outpatient basis, which is something that's new and really catching on with other providers around the country in the form of outpatient joint replacements and having patients come in and out same day. We've also added a new spine division. We've added some other subspecialists now to our surgery center that are fulfilling cases, especially in our spine service division that started enhancing the spine service line. Many of the procedures today more and more are moving toward an outpatient arena. So adapting to that cultural change and looking at the future, and where healthcare is going on an outpatient basis, it was time that we needed this new center. And so on October 1, we received all the official OKs and the state licensing, and we opened up. Patients can, or anyone listening to the podcast can go to Mercer County Surgery Center website and look at a virtual tour that was completed. We've provided an opportunity for patients to do a walkthrough tour, which is kind of a unique approach to making patients feel comfortable that they're at a very good center.
Yes, and that website, www.mbortho, that's MBORTHO.com. You can see the new state-of-the-art ambulatory surgery center right in the middle of the website. Great website. And you can also see the virtual tour, as Tony mentioned again. And that's mercercountysurgerycenter.com is where you can also see that tour. So congratulations on the expansion, and continue to keep up the great work with the new center, and we look forward to possibly hearing more about that down the road.
Yeah, thanks, Joe.
And Tony, talk about partnering with Greenway Health, some of the products that the practice currently uses, and what led you to Greenway Health?
Joe, we currently are using the Intergy platform, and we're up to speed on the latest issue of Greenway. The ability to drive and partner with Greenway was really a strategic issue a few years ago when we adopted the EMR technology. Greenway was one of the few that offer a very good one-stop shop operation where the scheduling and billing and financials and many things are coordinated under the one package that Greenway offers. So what was attractive to us when we installed the opportunity or installed the package is the fact that we weren't dealing with multiple different vendors that may have been one scheduling vendor and this other vendor all under the same control and package. We have grown and adapted a number of different products using the Greenway and integrated technology with dictation, some other templates, things that really led us to achieve some financial success by this partnership, reducing operating costs because of more efficiencies with the Greenway platform. So it's worked out very well. We have some very specific features and staff utilization that are trained in the product very well. The physicians encourage full use of the EMR technology. So it's worked out very well. Our partnership with Greenway continues to thrive. We feel very confident that Greenway provides a good, realistic approach to our needs.
And how is Intergy and the other technology solutions you mentioned? You guys stay, up to date on the latest versions and any of the updates that are pushed out. How has that helped the practice not only maintain its patient base, but as we just talked about, growth into a new location and the multiple locations you have? How has that assisted with the growth of the practice through the years?
So as Greenway's developed some integrating different technologies, it's allowed us to really take a different approach on patient engagement, reaching out to patients via communication, via text, via email. I think the world, Joe, is slowly changing away from phone calls, and it's become more encompassed into text messaging and communicating via an email system. And Greenway, partnering with Greenway gives us the opportunity to take every single enhancement and look at how we can achieve better communication, better technology framework within our organization. When you're seeing about 100,000 patients a year, it's an interesting dynamic, and you're seeing a range from younger people to a broad range of ages. Some people are not, technology driven. The younger generation, much technology driven. So we find the need to partner and have a solution that can provide, multiple crosses to our organization. And I think that's what each enhancement and development with Greenway as a partner really addresses and helps a single provider or helps the providers in this capacity to achieve certain results that might be specific to their demands and populations.
And if there were other orthopedic practices out there considering Intergy, what advice would you give them as they look for a vendor?
Joe, I would consistently say the one-stop approach that we have used has seemed to work very well. Having a single partnership with a single vendor, it is a very good performance, a good solution. I would say that you need a vendor to understand your needs, understand where you're going, understand the opportunities, what problems you have. And when you look at the products that you're looking at, select the product that's going to fit your need and offers you some very good solutions, be it clearinghouse solutions or billing solutions, fully integrated, not a mixed up or chopped up product where you're branching off to, several different products to get your end mission. So I think that's what I would tell, and I've told other orthopedic groups that, the Intergy product, I believe, is a very good A-class product. I'm very anxious and continue to support the Greenway model and the development of Project Polaris as that's ongoing in development and participate in some of that. Number two is, Joe, I think it's extremely important from the Greenway standpoint is that or other orthopedic, ensure that your provider or your provider of IT services has a communication link with you. It's so important to understand the dynamics between a company such as Greenway and what your needs are. Just ensure that it's not just a sales position where somebody's trying to sell you a product and they go away for a year. They truly need to be engaged in your business. And if you don't feel that engagement, and it's not going to work out. I think that's so important that somebody understands a customer's needs, and I think when you do that, you achieve great results.
And as we turn the page into 2019, Tony, what lies ahead for Mercer Bucks in 2019? Continued growth, expansion? What are some of the things you guys are thinking of doing that you can share with us?
Sure, Joe. We're always looking at the opportunities and the healthcare changes, the payer relationships, where the payer systems are going, and taking each item and opportunity and saying, how do you continue to develop the model and fine-tune the model of patient engagement and what other services can you provide. The whole system, as we've talked about before, Joe, is moving into a more and more of an outpatient arena. It's important for us to continue to secure the vision and the opportunity of that growth and saying, keeping pace with the industry standards and really shaping the world in a different fashion. As I mentioned, it was a significant step when we developed and started the whole outpatient spine and joint replacement program. And now you can see the whole industry trend of really outpatient joint replacements is really something that you'll find at many other states and many other centers. So we're always looking at that opportunity and that next step and trying to stay ahead of the curve of the healthcare platform and relying on many of the opportunities that we use with Greenway to help us stay focused on some of those items, such as patient engagement, such as the next step of Project Polaris.
And I thank Tony Mulchaney, the CEO of Mercer Bucks Orthopedics, my guest on this episode of Putting Possibility into Practice, as we highlighted the functions and possibilities that practices can experience orthopedic practices can experience, by using the Greenway Intergy platform. If you would like more information on Mercer Bucks Orthopedics and to get a virtual tour of that new surgery center we talked about, you can visit their website at www.mbortho.com. Tony, once again, thanks for your time.
Joe, thank you very much for the opportunity, and it's always look forward to these podcasts with you. It's always a pleasure to chat and communicate, so keep in touch and look forward to the next opportunity, Joe.
And for more information about Greenway Health and about the product solutions that we can offer through a partnership with your practice, please visit our website at www.greenwayhealth.com. And if you enjoyed this episode of Putting Possibility into Practice, and I hope you did, I invite you to subscribe to our podcast on your podcast platform of choice. I'm Joe Augustinelli, the social media manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. Thanks for listening.